Good morning, everybody. It's Dr. Galvin with another post-ER night shift update. If you're new to these videos, my name is Jeffrey Galvin. I'm a board-certified emergency medicine physician. I also run a functional/precision medicine clinic outside of Charlotte, North Carolina. I've been posting video updates about what's going on for real in the hospitals and trying to give unbiased information about COVID and its effects and vaccinations and everything else since this started. If this is only of interest to you, please subscribe to our page and like us, and click the little bell so you can get updates when I post. I've just worked 3 nights in a row, and it's been hard. I think it's a combination of just massive amounts of COVID patients and honestly a fair amount of burnout. I'm not the only person that's kind of experiencing this. It just gets frustrating. We're seeing patient after patient coming in, many of them very, very sick, the majority of them unvaccinated. And because the hospital is so full, we have no ICU beds, not only not in our hospital, but really in the region. So we actually have got 2 beds in the emergency department converted to, quote, ICU beds, meaning that they're using them as ICU beds, and the ICU doctors are kind of managing them remotely via telehealth. And because of that, we've had ventilated patients with COVID in the ER, and just over the last weekend, multiple of them have died. And what was disturbing, and I think I alluded to this the other day, is after now that we're sort of boarding these patients in the ICU here, and we're more involved in their care. Now, normally someone comes in very, very ill with COVID, I admit them to the ICU, and they go up to the ICU, and then I really, I don't take care of them anymore because they're out of the emergency department. Well, these ICU patients are still partially ours, so we're seeing kind of this progression that the critical care people have been seeing all along, and as such, end up having quite a few conversations with the critical care team. And what we're finding and what we're learning is that the majority of these people who are getting intubated related to COVID are not making it. Something 80 to 90% of them are dying once they get put on the vent. And we've seen that this weekend. We've had multiple people die after being put on the vent here. Now, people ask the question, well, why would we put somebody on a vent if they're going to die? Well, your chance of dying if you stop breathing is 100%. And so, even if there's that small chance, most families and most patients want to at least take that opportunity. We do everything possible to temporize and not put people on a vent, but eventually it gets to the point where they just reach exhaustion, their oxygen levels start dropping, and it's either, put them on the vent or they're going to die. And we did have one person this weekend who decided that did not want to go on the vent and ended up passing away, not on the vent, but just, I get it. You go on the vent, they sit, you get put asleep and you're paralyzed, and you just never basically wake up. And we just had a family acquaintance, family friend who just lost her mother after a battle with COVID on the ventilator for several weeks, and it's just heartbreaking. And it's preventable. All these people we're seeing are unvaccinated. I had one vaccinated person that was very, very sick and required ICU admission, but he was also, 89 years old with underlying medical problems. He was, fully vaccinated, but he's a high-risk person regardless. What we're typically seeing, and just this weekend, we're talking about 40 and 50-year-olds, and the majority of what I saw this weekend were really sick. And then there's this weird conversation I have in my head now with a lot of these people that have, advancing oxygen requirements that look like they're probably heading down this road of requiring the ventilator. I realize I'm probably talking to a dead person. If it progresses at this clip and they end up on the vent, it's very highly unlikely that they're going to survive, which is heartbreaking. Enough of that. I wanted to briefly talk about post-COVID psychosis. I got a heartbreaking email from a viewer who is a nurse and lost her husband to suicide after a relatively minor case of COVID. And after she wrote me this email, I started doing some reading about it, and it's a rare complication, but there are multiple case reports of people developing florid psychosis after mild to moderate COVID infections. It's typically 30 to 50-year-olds that develop this, and these are people that have no psychiatric illnesses, and they develop psychosis. And what's psychosis? Psychosis is sort of an impaired sense of reality. And that may be hallucinations, it may be delusions, it may be agitation, it may be suicidal thoughts or suicidal actions. And some of these people have committed suicide. And the typical story is that they have a mild case of COVID or a moderate case of COVID. Maybe they're in the hospital and they come back and they're basically a different person, and they start having all these psychiatric symptoms. Normally, psychosis does not typically occur in those age ranges, but it's clearly related to COVID. We don't know what the cause is. It may be related in a way to some of the other neurologic, these long COVID symptoms that I treat in my clinic now all the time, brain fog, academic performance problems. We think is probably related to inflammation of the brain related to the virus. And it may be that the virus is somehow rewiring the brain in some ways. And in a certain small subset of people, they're developing really severe psychiatric problems. From the case reports that we're seeing, remember, this is still a relatively new thing. We're just learning. It seems that some people, it resolves on its own and they don't need any long-term care. Other people need to be on psychiatric medicines and for at least a period of time. Again, it's a rare finding and we're still learning, but it's something to be aware of. And I guess the point, and I think the point of the woman who sent me the email was that, this is not something that's widely known. And if you have a loved one who has COVID and starts acting strangely, then it's really important that they get assessed, because in rare cases this can lead to suicide. And it's an absolute tragedy if that's the case. So if you have someone in your family or friends that has COVID and is acting strangely afterwards, there's this thing called post-COVID psychosis, and it's a real thing. Try to get that person help so it doesn't progress. I'm going to sign off from now. It's been a long weekend of night shifts. I will give you more updates as the week progresses. Everybody stay safe, get immunized, please. Please don't come see me in the ER. Don't be another unimmunized person that I have to worry about is going to be dead in a couple weeks because they did not get a simple, safe immunization. It's an absolute tragedy, and we're seeing more and more people getting A, really sick, or B, dying, basically because they don't want to get immunized. And I've taken care of hundreds of COVID patients now, and I've yet to take care of a single person harmed by a vaccine. And your risk of crashing your car on your way to get the vaccine is 1,000 times greater than the risk of getting the vaccine. Anyway, I'll get off my soapbox. Everybody stay safe, wash your hands, wear your masks, stay, just protect yourself. COVID's pretty bad. I am starting to see a little bit of a drop in the numbers, which I'm hope will continue, but it's still dangerous. Take it easy.